Good evening, guys. Tonight's discussion D, we're discussing a new preclinical study involving the amyloid plaque in dementia. So here we go with tonight's presentation for y'all. In short answer, a new preclinical study identifies a toxic amyloid beta subtype that appears very early and shows an experimental small molecular NU9 can clear it and prevent downstream brain changes in a mouse model, suggesting Alzheimer's progression may be stopped long before symptoms if similar approaches translate to humans. Summary of study. Northern Northwestern researchers report that a previously unrecognized, highly toxic amyloid beta subtype accumulates inside stressed neurons early in disease and appears to trigger inflammation, neuronal dysfunction, and immune activation in mice treated before symptoms appear. Treated before symptoms onset. The small molecular NU9 reduced that toxic section, lowered early pathology, and prevented the cascade that normally leads to neurodegeneration. Northwestern now. Why this matters. Alzheimer's pathology begins decades before symptoms, so interventions in a pre-symptomatic window could be far more effective than late-stage treatments. Detecting who is on that early trajectory is becoming feasible. Blood biomarkers, amyloid tau measures, and advanced tau PET trackers can identify at-risk people. Years before dementia. Key considerations and decision points. Targets sections NU9 targets an early toxic oligomer subtype that rather than bulk amyloid plaques. This may explain why some anti-amyloid trials failed when started too late. Northwestern now. Timing. The study models pre-symptomatic treatment translating to humans requires reliable early detection, blood tests, PET scans, and safe long-term interventions. Translatability. Animal success does not guarantee human benefit. Pharmacology, dosing, safety, and human biology differ. Okay, risk limitations and Next steps. Preclinical only. NU9 results are in mice. Human trials are required to test safety and efficiency. Northwestern now, biomarkers, uncertainty, certain blood and PET markers improve early detection, but still need standardization and validation for population screening. Complex biology. Alzheimer's likely involves multiple pathways. Amyloid TAU, neuroinflammation, mitochondrial dysfunction. A single agent may not be sufficient for all patients. Practical takeaways. Research milestone. This work supports the strategy of intervening very early and targeting specific toxic species rather than late stage plaques. Near term impact. Expect follow up. Step safety studies, biomarker guided trials, design, and combination approaches that also address tau and neuroinflammation. Okay, here's the second part, guys. Stopping Alzheimer's before symptoms may be possible. A Northwestern team found a previously unrecognized highly toxic amyloid beta that accumulates early and an experimental small molecular NU9 cleared that species and prevented downstream pathology in a pre-symptomatic mouse model, suggesting early biomarker guided intervention could block disease progression. Summary of the new preclinical results. Northwestern researchers identified a distinct highly toxic amyloid beta subtype that accumulates inside neurons early and appears to trigger inflammation and neuronal dysfunction. Treating mice before symptoms onset with the small molecular NU9 reduced that marker and dramatically lowered early brain pathology. Northwestern now Department of Chemistry, Northwestern University. What NU9 does and why it matters. Mechanism. Preclinical NU9 selectively reduced the newly identified toxic marker subtype and suppressed widespread neural inflammation and early neuronal changes in the mouse model. Why early targeting could work. Alzheimer's pathological changes. Amyloid species GALA activation began decades before clinical symptoms, so intervening in a pre-symptomatic window may prevent the cascade that leads to dementia. Clinical translation, key hurdles, safety and dosing in humans must be established for NU9 mouse efficiency. Does not guarantee human benefit. Early detection is essential. Biomarker-based screening of blood amyloid tau assays, PET scans will be needed to identify candidates for pre-symptomatic treatment. Complex disease biology. Alzheimer's likely involves multiple interacting pathways, amyloid, tau inflammation. Single agent prevention may help some, but not all patients. Practical takeaway and what to watch next. Important. This is a preclinical milestone that supports early biomarker guided intervention as a strategy. Next steps to follow. NU9 safety toxicology studies, first in human trials, biomarker driven trial designs, and whether combination approaches amyloid plus anti-tau inflammation outperform single agents. Department of Chemistry, Northern University. Stopping Alzheimer's before symptoms may be possible. A Northwestern team found a previously unrecognized highly toxic amyloid beta that accumulates early, and an experimental small molecular NU9 cleared that species and prevented downstream pathology in a pre-symptomatic mouse model, suggesting early biomarker guided intervention could block disease progression. Summary of the new preclinical results. Researchers identified a distinct, highly toxic amyloid beta subtype that accumulates inside neurons early and appears to trigger inflammation and neuronal dysfunction. Treating mice before symptom onset with small molecular NU9 reduced that biomarker and dramatically lowered early brain pathology. What NU9 does and why it matters. Mechanism preclinical. NU9 selectively reduce the newly identified toxic marker subtype and suppressed widespread neuroinflammation and early neuronal changes. The mouse model Early targeting could work. Alzheimer's pathology changes amyloid species. GALA activation begins decades before clinical symptom. So intervening in a pre-symptomatic window may prevent the cascade that leads to dementia. Okay, guys. Those are your shows tonight. I will be back on tomorrow for shows. Until then, Gator Wellness, take care, folks.